Today on Beyond the Image, we're sitting down with Veronica Knight, Mammography Technologist, to talk about the importance of mammograms, annual screenings, and the difference between screenings and diagnostics. Thanks for joining me, Veronica.
Oh, you're welcome. Anytime.
So let's start by giving our viewers a little bit of insight into your journey, what brought you to Steinberg Diagnostic, and how you became and why you became a mammo tech.
Okay, so Steinberg was on the roster since I lived in New York. I was looking at opportunities to move here, and basically when I looked up Steinberg Diagnostic, I saw all the things that I needed to see in a company. Like, they were diverse, they gave more opportunities to grow. It wasn't just like I stay at the same level. I'm actually a trainer in mammo as well, so I train all the new employees that come here. So, and then as far as what brought me into mammo, when I was in high school, one of my friends was like, "Oh, have you ever heard of X-ray?" And I'm like, X-ray? So it actually got me excited into, like, 'cause I love science, so like the bones and all that stuff. And so basically once I started like interviewing in X-ray, then I was introduced into mammo, and then I never left. I love it.
Walk me through what you do every day. I mean, obviously you're doing mammos, but talk to me about, you know, some of the administrative things that you're doing. Are you looking at patients' charts? What kind of conversations are you having with patients?
Oh, okay.
Just what does your day look like?
Okay, so basically for my day-to-day, I walk into the office and I turn on my machine. I look at all my patient history and things like that. And then as the patients come in, I talk to them, I explain to them the procedure, I make sure that they're comfortable with actually doing the mammogram, and I explain the difference between what they're here for, if it's for their annual or if it's for a diagnostic mammogram, and why we're doing it.
Awesome.
Yes.
So tell me, what is the difference between an annual mammogram and a diagnostic mammogram?
An annual mammogram is basically a mammogram where you have no symptoms. It's just your routine screening. So if you don't have any pain, any lumps, anything like that, that's an annual mammogram. A diagnostic mammogram is when you have a symptom. So if you have a new lump that you found, or your doctor may have found a new clinical symptom, that would be a diagnostic mammogram, or it can be a callback. A callback is basically a callback from a screening, and then we found something on your screening mammogram.
Is there something different in the way the procedure is done and processed, or is it kind of the same thing? What could a patient expect if they're coming in for a diagnostic? They've had a ton of annual screenings, but this is their first diagnostic.
Okay, so if you're coming in for a diagnostic mammogram, basically what you should expect is us to explain the procedure. So if you're coming in for a mass, for example, if we have to do spot compression views, or if we have to do extra 3D pictures, each protocol is different for every patient, but it's pretty much the same as far as the low dose radiation.
Okay,
yes.
So is there extra compression? What does that spot mean?
The spot compression is extra compression. It smooths out the tissue. It makes sure the doctor knows the difference between a mass and if it's just a tissue that's overlying. So a little overlying tissue.
What is the importance of an annual screening? So research shows that about 60% of women get their screening every year, but that leaves almost half of the women that are of age to get an annual screening don't get their annual mammo. So what do you want to say to those women that are not getting their screenings?
Definitely go get your screening mammogram, because every cancer is not felt. Some symptoms are undetected, and that's why we do annual screenings, because you never know if there's something hiding under your tissue. This is why we do this. It's very low dose. Come and get it. It's a little bit of compression can save your life.
So as women, right, we're very busy. A lot of women have families and other people that they're caring for. Is this one of those procedures that's going to take a really long time and is going to take a big part of their day away?
Not at all. If you come into the mammo room, it takes about 15 minutes or less for a mammogram screening. Yes.
So is that how patients are scheduled, is every 15 minutes?
Yes, it's every 15 minutes.
Okay, so they can expect 15 minutes or less in and out.
That's right.
Easy to go.
Nice and easy, yes.
What is the biggest challenge that you face as a mammo tech?
People being afraid. So a lot of people are afraid of mammograms, but if they just come in, talk to us, we usually calm you down, letting you know that If you feel a lot of pressure, we do need the pressure, but if you feel too uncomfortable, we can always adjust, and we would never want to hurt you. Our goal is to help to detect the breast, if there's breast cancer and there are other symptoms that you're having, we just want to keep you at ease.
Do you ever see something on someone's mammo as you're looking at the images to make sure that they look good? Can you tell patients what you're seeing at that time?
Unfortunately, no, we cannot tell the patients what we see because we are not physicians. Physicians are highly trained, and they look at the images, they make sure everything's okay, and then if I see anything, I do notify the physician, and I make sure that they are aware of it.
So you see a lot of women every day, every 15 minutes, 5 days a week. That's a lot of women that you encounter. So I'm sure you've heard a lot of stories. How do you deal with the emotional side of these details that you're learning about all of these women?
Honestly, I take my time with them. Even though it's only 15 minutes, if they need a little extra time to talk, to feel comfortable, I do make sure I take the time because each patient is special to me.
Do you have a favorite patient or a favorite case?
My favorite patient, she comes every year and she's always like, Veronica, she gives me a hug. She's like, you're still here. I'm so happy you're still here. Never leave. Every year she's just so happy and vibrant, and she's my favorite patient. Yes.
Awesome. Do you see a lot of the same patients year after year?
Oh, yes. Yes.
Build relationships over time?
Yes. They tell me about their families, their cats, their dogs, what's going on, what's new in life. I hear it all. Yeah.
What is the most common patient complaint or concern that you hear?
The compression. The first thing they walk in, they're like, oh my gosh, are you going to compress me very hard? They're very nervous about it, and it's just calming them down and helping them realize that it's important. It's an important test. We're here to help them, or not to hurt them, and that's the main thing.
Are there any tips or tricks you can give patients on how to make a mammo more comfortable, or?
Just relax. Relax your shoulders, pretend you're on the beach. I always tell them, this is a spa experience. We dim the lights. We make sure you're comfortable. And if you feel uncomfortable at any time, just let us know. We won't keep compressing you and tell you, just hold on. We never do that. We always make sure you're comfortable at all times of the exam.
Can you tell me, as a patient, what can I expect? What is this procedure like? What is the experience going to be like for somebody who's never even seen a mammo machine before?
Okay, so when you walk into my room, first thing I do is I introduce myself and I explain to you there's going to be at least 4 pictures. There may be more depending on how much tissue I get, that there is compression that's involved with the exam. If it hurts, let me know. I won't keep compressing you. I don't want to hurt you. And basically, I tell them that compression is very important for the exam to make sure the tissues are nice and compressed, so that way we can see underlying tissues. Because if we don't compress, then we don't get a good exam.
Can you give me a little bit of a description of, what does the machine look like?
Yeah.
How does that positioning work? How much touching is involved?
Yes.
How uncomfortable is it going to be? How close and personal are we going to get?
Yeah. Okay, so the mammo machine has plates. So we have a plate at the bottom and a paddle at the top. At the top, we place your breast onto the paddle, and then the plate, and then the paddle compresses down on your breast. There is a bit of compression. It feels like I want to say somebody, if you grab your hand and you just push like this, it'll feel like that if you put a good amount of pressure on it. It is a sensitive part of the body, so it won't be 100% comfortable. It'll just feel like pressure. There is a good amount of touching involved as far as touching the breast, because that's just how a mammogram goes. But we always make you feel comfortable.
And so is the breast compressed for that whole 15 minutes?
No. So there's only a few seconds of compression. So we grab the breast, we put it on the plate, we compress for a few seconds, we go back, shoot, and it comes up automatic. It doesn't hold, it will come up automatic.
Talk to me about Steinberg Diagnostic as a business. What do you think sets SDMI apart from other organizations?
Patient care. Patient care does set us apart. I feel like with us, we make sure every patient is seen, heard, and then loved on. Because honestly, coming in, I was a patient at one point when I had Ava, when I had my daughter. I came in and I felt the same love and respect. And we always make sure the patients listen to and respected. Yes.
What's your favorite part of your job? What's the most rewarding?
I feel like a superhero when I come into work every day. Even though I don't have x-ray vision, I feel like my machine is my x-ray vision as far as detecting breast cancer. I love it. I love it. Every day I feel like a superhero.
What advice could you give to someone who's maybe considering a career as a mammotech?
Do it. I say go for it. Actually, my tech aide is going for X-ray school. I convinced her. She's actually got into the program. She's into the program, and she's going to be a mammotech. And I tell her every day, like, if you want to save lives, do this. Like,
How long does that process take?
So it's about 2 years, depending. I have my bachelor's degree, so it took me 4 years, but it depends on what path you take. But it can take as little as 2 years to become an X-ray tech, and then the extra amount of schooling you have to do for mammo, as far as like the class you have to take, and then you have to do at least 100 mammograms before you're certified.
What changes have you seen in the technology in your time as a mammotech?
Okay, so it went from 2D, the dinosaur machines, to 3D. 2D machines, they were a lot more bulky, harder to move. This one, you literally press the button, it goes for you. As far as QC is involved, it was a lot more QC with the numbers, having to write down each number by hand. Now the machine calculates everything for us for the most part.
What are your aspirations for the future?
Ooh. I want to just continue to grow in my career, and I want to continue to help people. Like, I love helping people. I love my job, and I just want to keep growing.
What has SDMI taught you?
Let me see. It taught me how to be a better person, honestly. I feel like walking in, like before with my other jobs, I always felt a little rushed. Here, they give me the opportunity to take the time with the patient. That 15 minutes is a good amount of time with each patient. It helped me to just grow as a person, and I love that.
If you could give patients one piece of advice, what would you tell them?
Come do your mammogram. Come do your annual mammogram. If you are feeling any symptoms at all, come take care of it, because it's not going to go away. Talk to your doctors. Get your certified breast exams every year. If you come to do a mammogram, don't be afraid to tell the technologist anything. Tell us anything you want. We are not here to harm you. We love you, and we just want to see you succeed, and we want to see you healthy.
So I like to end with one final question.
Okay.
What would your younger self be most proud of you for, or most surprised about?
That I actually am successful in life. Like, I think when I was younger, it was harder for me to see that. Like, growing up in the neighborhood that I did, a lot of kids didn't have the opportunity that I did. And I am so proud of myself for actually going to college, getting my degree, doing X-ray, and then becoming a mammotech. It's such an amazing opportunity for me. I'm happy that I was able to do it.
Awesome. Thank you so much for your time today.
You're welcome.